Hey friends, Dr. Nixon. Hope you're doing well. Happy day, happy Thursday. We're talking about the Delta variant today. We're really talking about the immune system. I wanted to hop on here and just share some thoughts with for the immune system, what people have been going through, getting COVID, loved ones getting it, what to do about it. I get these questions literally every single day. And so just want to give you a little bit of my perspective and just more of a personal story of what I did when I had COVID, what I would do if I got the Delta variant. And again, listen, this isn't medical advice. I'm not your medical provider. This is me just giving you guys some insight into what could actually really be helpful to your body, and from a more of a holistic standpoint as well. So I'm gonna jump in here with you guys. Hey, thanks y'all. Thanks for joining us. Hop on, ask any questions you got, and we'll have fun doing this together. So, hey guys, hey Ashlyn, I see y'all. Thank y'all so much for hanging out. Let's talk about it. COVID's here. It's mutating. It's a virus. It mutates. It's what it does. If you've had it, you might be one of those people who would say it wasn't very much fun, and I would agree with you. I had it last February before we even called it COVID. It wasn't fun. I missed 2 days of work for the first time in a decade, and so now over a year later, we've learned a lot. There's still a lot of questions about how the virus works and what it does and doesn't do and all of that. And but we have learned a lot about the mechanism at which it attacks the body and hinders the body and creates an inflammatory response and a cytokine storm and all of these things. And with that information and knowledge and wisdom comes different holistic ways that we can actually, things that we can do to take care of our body. So I'm gonna give you guys a little bit about what I would do if I got the Delta variant. And honestly, just what I did too when I had it. So this is my antibody test right there. This is from, again, last year. I got my antibody test in April. And antibodies, remember, an antibody is your immune system's response after you get the virus. COVID came in my body. It was not fun. I had the fever, all the flu-like symptoms. Fatigue was one of the worst ones. I had the cough. I mean, I honestly probably had that dry cough for a few weeks. Even after I had really recovered, I'd say even 3 to 4 weeks later, I would be exercising or running and I'd still feel some of that. So that antibody test, I did that last April just to confirm, hey, it was actually COVID that I got. It just made a lot more sense. So, hey guys, thanks for joining us. Appreciate y'all hopping on. We're talking about the Delta variant and what I would do if I got it and what I did when I had COVID. So let's jump into a little bit of this from the information that we're getting, even just anecdotally with patients. One of the big concerns for COVID is that it obviously affects your lungs and your oxygen capacity. The byproduct, or one of the byproducts, can be that you also get a co-infection, a bacterial infection in your lungs known as pneumonia. If that sets in, oftentimes the patient's in trouble. So one of the first things I would do if I got COVID again, or if I got the Delta variant, is I would be using colloidal silver. Colloidal silver is a natural antibacterial. Lululemon uses it in their no stink clothes, right? So because it kills bacteria. So, but you can use colloidal silver through a nebulizer. A nebulizer, anyone who's ever had asthma before or knows someone who's had asthma, they oftentimes use a breathing treatment called a nebulizer to inhale a version of a steroid for asthma. But you can use colloidal silver in a nebulizer to get the silver nanoparticles deep into your lungs to kill bacteria. And the goal here is that you'd be able to prevent pneumonia. I think a lot of people, especially the younger people, when they get COVID, it's not fun. Their immune system works, they kill it off, but if they get a co-infection of pneumonia, oftentimes they're in trouble. So one of the things I would do personally for myself is I would be using a nebulizer with colloidal silver as a breathing treatment in the beginning of it. Here's another one, and again, just stuff we've learned as more information has come out. COVID can wreak havoc on your oxygen capacity. The way it does it, the research is showing that it affects your red blood cells It makes them stiffer. It makes them harder to transport. It can lead to things like blood clotting issues. Okay, so with that information, the holistic approach would say, okay, how do I take care of my red blood cells or the vascularity of them if I get COVID? Well, the natural blood thinner would be garlic. So you can do this in several ways. You can cut up cloves of garlic. That's probably what I would do, is I'd cut them up and swallow them. You're gonna stink, but you shouldn't be around people anyways, right? It doesn't taste good, but you might not be able to taste anything anyway. So it's a win-win. I would cut up cloves of garlic for myself and swallow them. You can also find them in pills, but garlic is a natural blood thinner. It'll help decrease, the goal would be to decrease the likelihood of blood clots. It would be to increase the red blood cell transport, ultimately trying to keep your oxygen levels up. Remember, with COVID, one of the things we see is oxygen levels dropping. So I think it's really important to keep red blood cell motion going. One thing to remember, if you've had COVID, some people can still have symptoms of it even months after. It takes up to 3 months for your red blood cells to completely recycle and replenish. There are ways that you can help yourself replenish red blood cells. Things like spirulina, things like chlorella, getting a good iron supplement would all be ways that you could do that. So those would be my real 2 heavy hitters right there. Colloidal silver, garlic cloves. These ones are we've been talking about this for a while. Vitamin D, vitamin C, and zinc. There's another research study that came out recently that talked about higher levels of vitamin D3 decreased exacerbated symptoms of COVID, so extreme symptoms of COVID, by 44%. Just by having higher levels of vitamin D3 was keeping people out of the hospital, off of ventilators, off of having bad COVID symptoms by 44%, just by getting enough vitamin D3 into their systems. Even nowadays, hospitals are treating patients with vitamin D3 for COVID. Why? Because it's helpful, it's effective. So I'd encourage you, next time you're a doctor, your doctor's office, your primary doctor, get your vitamin D3 levels checked. Try and get that number up. Last one, stay hydrated. It is important if you get COVID, your body's working hard. You're probably not gonna wanna eat a lot of food, but it is very important to hydrate. You're most likely gonna have a fever. A fever is a normal response to your body killing off a virus or a bacteria, but you have to stay hydrated. Water, coconut water, water with lemon, bone broth, kombucha, all the good stuff. I hope this was helpful, guys. That's how I would take care of myself. And again, remember, this isn't medical advice personally for you. This is what I would do if I had the Delta variant or got it. And it's what I did. A lot of it's what I did when I had COVID. The 2 things I wish I would have done more of when I had COVID a year ago was more nebulizing with colloidal silver, and the other one being the garlic, either garlic pills or chop up the cloves. And yeah, you're gonna smell, but it's okay, because you're gonna kill off a virus and then you're left with antibodies, and that's a good thing. So bless you guys, love y'all, stay well, see y'all next time. This was Dr. Nixon with Twin City Health.